Welcome to my channel Brainies. Today we are going to discuss about the topic meningitis and tests for meningitis. A brief intro about meningitis. So what is meningitis? Meningitis is nothing but it is an infection and inflammation of the fluid and membranes surrounding the meninges of the brain and the spinal cord. The inflammation from meningitis typically triggers the symptoms such as headache, fever, and a stiff neck. Let us classify meningitis based on the count of WBCs. Classification of meningitis. So bacterial meningitis, the count is greater than 100 WBC plus per microliter or greater than 90% of the PMN cells, polymorphonuclear cells. Viral meningitis ranges between 10 to 1000 WBC per microliter or greater than 50% of lymphocytes or less than 20% of polymorphonuclear cells. Fungal meningitis ranging between 10 to 500 WBC per microliter or greater than 50% of lymphocytes. The last but not least, it is tuberculosis meningitis ranging between 50 to 500 WBC per microliter or greater than 80% of the lymphocytes. Let us just see the test for meningitis. The first sign is the KERNIG'S sign, which is nothing but the patient is positioned supine with their hips flexed to 90 degrees. The test can be considered positive if there is pain on the passive extension of the knee. Let me show you the picture depicting this. So this is a picture depicting the KERNIG'S sign. So positive KERNIG'S sign. So what is considered as a positive KERNIG'S sign is if there's an inability to extend the knee beyond 135 degrees, that is considered as positive. In severe cases, patient will be unable to extend the knees even beyond 90 degrees itself. The maneuver was performed with the patient seated in the upright position with the hip flexed to 90 degrees to the trunk. This is a picture depicting both the sign. The next we are moving on to BRUDZINSKI'S sign. So this is BRUDZINSKI'S sign. In this case, the patient is positioned supine and just passively, gently flex the neck. So the test can be considered positive if this maneuver causes flexion of the hip and knee. That is, when we slightly flex the neck, forward flexion of the neck causes the patient to involuntarily flex the hip and knees. So that is considered as a positive BRUDZINSKI'S sign. Despite their historical significance, a positive result from both the tests, from either of the tests, it has not been shown to be a reliable indicator of meningitis. Let me show you the picture once again. So this is a picture depicting the KERNIG'S sign as well as the BRUDZINSKI'S sign. You can see it in the picture. This is KERNIG'S sign where there's a resistance to extension of the leg while the hip is flexed, inability to extend the knee beyond 135 degrees. And this is BRUDZINSKI'S sign where the slight forward flexion of the neck causes hip and knee flexion. That's it with the test for meningitis. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.